be the squeaky wheel. I give you permission to be quote unquote annoying. If your doctor doesn't have time to sit down and answer questions with you, honestly, you need to find a new doctor. Finding someone who's open to that is so key because that is the first step. You're trying to advocate for yourself. You're trying to educate yourself. And your provider should be very willing to do that with you.
I would love to just kind of hear your elevator pitch, if you will, as to who you are, what you do, etc.
When my daughter was born, a few months afterward, she was diagnosed with a rare form of infant epilepsy. And after several pharmaceutical medications failed to control her seizures, we were introduced to a ketogenic dietitian. And she went on the ketogenic diet therapy, and it changed her life and our life forever because it worked perfectly. And my little medical doctor brain, who, here I am about to finish my residency and go out into the real world, had this moment where I thought, no one told us this. Like, no one told me that changing what you eat could have such a profound impact on your brain health. And so that was the spark that lit the fire. And since then, I've sort of kept chasing it and learning as much as I can. Back in 2021, I became board certified in lifestyle medicine, which is really what ties in general health to my ENT world. I mean, when you look at statistics, 74% of the American population is overweight or obese. 50% of the population has prediabetes or diabetes. If you want to get a little more into my world, 30% have obstructive sleep apnea, 20% have reflux. The incidence of allergies, food allergies, environmental allergies, asthma, all of these things are rising. Why, right? Why are we getting sicker and sicker when, we boast about having one of the best economies in the world? And I think it does come down to the environment we live in. And that environment is what we eat, what we put on our bodies, what we touch, what we breathe in our air, how we move our bodies, how we sleep, right? All of these things. A lot of people, kind of still scratch their head and say, well, okay, fine, but you treat tubes and tonsils. Like, what are you doing talking about this? Because it's sort of like once you take off blinders to these issues, you can't put the blinders back on. And you start to see it everywhere. Every patient that walks in my door now, I'm going, oh gosh, you're having these chronic headaches and your urgent care has been giving you antibiotics and steroids. Guess what? You're not having sinus infections. You're having migraine headaches. Let's talk about that instead. Or your reflux issues are out of control and you can't sleep at night. Oh, you're eating a bowl of ice cream before bed every night. Let's cut that out and see how you do. I'm telling you, it changes lives and it's so much fun and I love it and my patients love it and it's great.
Yeah, no, I think it's the most obvious right in front of us thing that, because it goes back to a lot of things, right? And I could talk about this for hours. So I'm so excited that you're on this podcast because there's so many different opinions out there and influencers that are spreading what I call like the misinformation around food. And there's people that believe eating ketogenic is the best approach. And it's like, well, it depends, right? It depends on what you're dealing with. Like, I did the keto diet and I dropped like 90 pounds maybe 5-6 years ago. And I haven't put on another pound, but everyone says, oh, once you lose the weight, you'll always gain it back. I didn't. And I have a thyroid issue. When I eat more of a carnivore-based diet or ketogenic diet, I feel my best. But for somebody else, that might not be the answer, right? So there's so much misinformation.
Yeah, exactly.
But nutrition and how we supplement, whether it be, and I'm not talking about a pill that you take to supplement. I'm talking about what is in your food, right? Eating meats that are rich in folates and all the things that we need as far as minerals versus, going and having a protein shake that's a made up synthetic type of protein in your body. And just different things like that I think our world, because we have such a convenience factor to food, we've lost the practicality and how to fuel ourselves and use nutrition as fuel rather than just I'm eating it because it's good, because it's easy, because I can swing in really quick in the middle of the day.
Right. Yeah. I mean, it comes down to two things, right? How are you fueling yourself? But also, why are we fueling that way? And like you said, it's convenience. We lead busy lives. We're overscheduled. We're overstressed, to be honest. And I will raise my hand and be the first to admit I am a stress eater 100%. If I've had a stressful day, I want to go to a Mexican restaurant and stuff my face with chips and salsa, right? And it's very clear to me, but that's often the first step, I think. And I like being able to walk alongside them as they figure that out, where they figure out what are the motives for why I'm doing the things I'm doing, right? Is it reactive? Is it proactive? That's the first step. I think the other thing to point out is when we're thinking about how we're fueling our own body, it's not just fueling our own bodies. We have a microbiome that covers every surface that can come in contact with the outside world. That's your gut, that's your skin, that's your nose, your sinus lining, your lungs. All of this has a very distinct microbiome of, bacteria, fungi, parasites, viruses. And actually, our bacteria in our gut are dependent on the food we eat for them to thrive so that they can help us thrive. And so that's where that, connection often comes between what we're eating and our gut health and our respiratory health.
Yeah, 100%. And I think